Parkinson's disease, a long-term progressive disorder of the brain that affects movement. It is estimated that 7 million people in India suffer from this condition, but very few people understand why does it happen.
Now, this condition involves the death of neurons in a region of the brain that controls movement. So today, let's take a look into Parkinson's disease and its various treatment options. I am Dr. Sonia Lal Gupta.
And I am Dr. Sameer Gupta. And welcome to Doctors on Call.
Parkinson's disease is a neurodegenerative condition of the brain that develops slowly over time. This disease occurs at the level of the brain cells, specifically in the area of the brain called the substantia nigra. This area is very important in controlling your movement. In Parkinson's disease, the neurons in the substantia nigra begin to die and cannot produce the chemical called dopamine. Now, dopamine is an essential chemical that regulates movement and coordination in the brain, and a decrease in this chemical can cause the symptoms of Parkinson's disease. One of the very first symptoms is something called a resting tremor, where there is a shaking of the hand at rest. This tremor can also be seen in the legs, arms and the jaw. Other symptoms include stiffness of joints, speech changes, changes in posture and changes in your walking, where you start making small quick steps and have difficulty with balance. Now, early diagnosis is important as medications can really help decrease the symptoms of Parkinson's. But we have to remember that this is not the cure of Parkinson's. We spoke to Dr. Robert Fekete, a movement disorder specialist in New York City.
As you know, this is a disorder of dopamine deficiency. So the gold standard medication is levodopa, which gets converted to dopamine inside the brain. Usually levodopa is packaged together with a medication such as carbidopa or benzasteride, which prevents its peripheral conversion to dopamine. And these medications are sold under the trade names of Matipar, Syndopa, and Sinemet. We also use medications such as dopamine agonists, which trick the cell into thinking that it's getting dopamine, but dopamine agonists are limited by potential compulsive behavior side effects. Now, Parkinson's disease has multiple comorbid features. They may include a decrease or loss of the sense of smell, and that's called anosmia. It also comes with REM behavior disorder, where people act out dreams, for example, by talking during sleep. There may be comorbid restless legs syndrome. And some patients also have comorbid Parkinson's disease psychosis, which includes hallucinations such as visual hallucinations and delusions, such as a delusion that somebody's stealing money from the patient. In addition, there may be a risk of Parkinson's disease dementia, which is a subcortical dementia that leads to cognitive loss, but it's nowhere near as severe as the dementia associated with Alzheimer's disease. Deep brain stimulation surgery can be a very helpful option for patients who have motor fluctuations. These include dyskinesias, which are involuntary movements reminiscent of dancing, and also wearing off symptoms where prior to the next dose, the patient's levodopa medication appears to wear off. Deep brain stimulation surgery provides a continuous electrical stimulation that aims to reduce these fluctuations.
Latest research and innovations like focused ultrasound are being investigated in Europe and the US, and hopefully we will have more options for people suffering from Parkinson's very soon.
Regular physical therapy and focused rehabilitation for Parkinson's disease can also help in improving the quality of life, and you should definitely discuss these options with your doctor.
That's all for now. See you next week.